My dad's sisters, my aunt, she was diagnosed with breast cancer and she had surgery and it appeared that she recovered, but about 4 years after that she developed problems breathing and they found out that her breast cancer had returned and ultimately she died from that.
Knowing that my grandmother had breast cancer brought her down. She stays to herself and doesn't want to be bothered with anyone how she used to. Having breast cancer brings people down.
Well, it did worry me, because I thought I had got rid of it. It came back. Then I started worrying about my family. My girls having cancer.
Breast cancer can occur when someone is younger, but typically it wouldn't be through a screening mammogram that we would find that. They would notice a change in their breast tissue or something like that.
Some of the known causes for breast cancer are just basically increasing age. The older we get, the higher our chances are. If you have family members, you're at a higher risk. If you have the breast cancer gene, you're also at an even higher risk of getting breast cancer. Having an early period or late menopause, having a late first birth are risks. There are many, many risks and many factors that can cause it, but mostly I think it's important that women know it's nothing they did or didn't do that caused breast cancer.
And specifically regarding breast cancer, doing mammograms to screen for breast cancer is part of the preventative health treatment that we provide or offer to our patients. Then after we find that she has breast cancer, I'm referring her to a specialist who deals with breast cancer and will discuss with her the different options for treatment.
We have always treated breast cancer with surgery, chemotherapy, radiation, and now some hormonal pills that women can take, but not everybody gets all of them and not everybody gets them in the same order.
Depending on the spread of the breast cancer, women receive radiation treatment, which is like radiation pointed at your chest wall that helps also kill the cancer tissues and the cancer cells that are in your chest wall.
Some of the treatments are getting better and better, and we're doing less surgery and more tailored chemotherapy, which is great for patients.
Systemic treatment, which is like giving, it's called chemotherapy, you may have heard of that, and that's taking drugs that are given through your veins that go into your system and go to kill the cancer cells that are in your breast.
Used to be that I needed space, needed time to make my own home place. Once or twice I kept an open door, but love unraveled and was nothing more.
Sometimes the tumors are just in the breast tissue themselves and they haven't spread anywhere else. So they just go in and they can take that lump out, and that's all they have to do.
Here today and on through, I see my light.
I had a breast cancer myself, and because of the kind of tumor I had to have a mastectomy. It was a very large tumor. With smaller tumors, they can do lumpectomies where they just take out part of your breast tissue, but the surgeon told me I wasn't going to be happy with the results. It wouldn't look good. So she said, you need to have a mastectomy. So I did do that, and so, I'm always aware that I only have one breast, Whenever I take a shower, I'm reminded of that. It does affect you your whole life.
In addition to the physical and health issues caused by breast cancer, Women also experience high emotional and psychological issues.
The emotional state I have observed in my breast cancer state patients has ranged from real fear, sadness. The biggest one I think is a loss of control, which makes people anxious and very scared lots of times. And then in some cases there's a sort of a resignation to understanding their treatment and their diagnosis, and then happiness when they've made it through the treatment and made it 5, 10, 15 years without having a recurrence.
Like with any disease, when you're told that you have something that you didn't want to have, it's frightening, and it's pretty devastating. There's two sides to it. There's the fact that you have cancer that I think any person would deal with, and then it's also that it's a woman's breast, and I think women identify their femininity with their breasts in many ways.
Our whole culture is very focused on appearance, and how you look is really important. And I think for a woman, their breasts are a big symbol. You know, you see this in ads and magazines and all this. So it's a big issue to have surgery. Even if you have a lumpectomy, it's still kind of, you end up with a scar. You have a little, you know, kind of like a little hole. So it definitely affects, you know, that part, you know, like the cultural side of things.
You have to come to the doctor a lot. You have to get treatments that sometimes are difficult, and it really puts a stress on patients, and it's hard to see sometimes over and over again. So it's just sad to know that people are going through a hard treatment and diagnosis. I try my best to be a person that can just be there for the patients and not get too emotionally involved, because I think patients need somebody who can hear them and not fall apart. But there are days when I go home and I'm very, very sad. And I wish people didn't have to have this disease, but I'm willing to stay there and be a support person for patients when I can.
Well, you know, most of my friends know that I had breast cancer, and they were very supportive too. So that was helpful.
The effectiveness of strategies are getting better because we're learning that the more we can specify a treatment for each individual patient, then we're more successful.
I was talking to one of the technicians after several of the mammograms I had, and she said, well, do you have any family history? And I said, yeah, my mom had breast cancer too. And she said, well, what happened to your mom? And I said, well, she lived for 30 years and she died when she was 90. And so the woman said to me, well, that means you've inherited her good survivor genes. I was like, huh, maybe I have. Maybe that is the way to tell this story. And so that kind of helped me rethink how I was thinking about breast cancer.
I think the general public should know that it's a disease that is common among women, and it shouldn't be something that we're so afraid of that we don't talk about it. I think we should continue to educate young women about changes that they might see in their breasts. We should educate women about their health in general, and again, as I said, finding things earlier is important, and that it can be a scary diagnosis, but it shouldn't be so scary that you don't do anything about it.
Women should know that it's a preventable disease, and even though many women have heard that a mammogram is a painful exam to have, I tell my patient that it's better to have a few moments of feeling some slight discomfort to, you know, being diagnosed with cancer when it's, you know, much later and hard to treat.
I'm not sure we'll ever find a one and done kind of cure for breast cancer, so I think we have to just keep trying to find it early and making our treatments better.
Toils and snares we have already come. 'Twas grace that brought us safe thus far, and grace will lead us And we've been here 10,000 years, bright shine.